Well, welcome everyone. Alex, it's so good to see you. I know
So
it's
good to
been a
see you.
while. Yes,
Yes.
it's been a long time. So thank you for agreeing to do this. And for all of you who are just joining us, this is a webinar sponsored by the Pudendal Neuralgia Association, and it promises to be a very interesting and beneficial webinar. I know I've known Alex for a few years now, and she has been a patron of PNA for many years now, probably over 10 years. Um,
Yes, since 2009, I think is
I
when we.
know that's a long time, my goodness. Um, so anyway, we're very grateful for you to do this.
Yes,
Um,
my honor.
Now, Dr. Milspaw is a licensed professional counselor in the state of Pennsylvania. She earned her Master of Education in Counseling Psychology and Human Services from Lehigh University and earned her PhD in the clinical practice of human sexuality from Widener University. Dr. Milspaw is a certified master NLP practitioner, certified consulting hypnotist, and mindfulness-based stress reduction trainer and consultant. She specializes in relaxation and stress management, as well as chronic pain and trauma. Dr. Milspaw is a professional presenter for sexuality and reproductive health education for local colleges, community agencies, and national conferences. She works with a variety of clients, including those coping with chronic pelvic and sexual pain, in an effort to reduce pain and associated emotional and psychological stressors. What sets Dr. Milspaw's Dr. Alex, counseling practice apart from many others is that she specializes in incorporating specific techniques of neuro-linguistic programming, NLP, including mindfulness and relaxation. If you have been suffering from anxiety, depression, hopelessness, this webinar is for you. So I'm very appreciative of all of you joining. And without further ado, I pass the microphone to Dr. Milspaw.
Thank you, Dari, for that lovely introduction. And yes, it's a pleasure to be here. As Dari knows, I love talking about what I talk about. And I practice what I preach. And there's a lot of important research out there that shows the importance of practicing what you preach in order to be effective of teaching these techniques and skills. And so make sure that if you are going to a mental health therapist or a life coach or something like that, that's working with you to learn some of these techniques, it's important to ask them if they're also practicing it themselves, because there's, again, just interesting research on that correlation. So I have an ambitious agenda as usual. Dari already introduced me, but I will add that I have only worked with the chronic pelvic and sexual pain population my entire career. And I am very passionate about this work. I'm passionate about bridging the gap between the medical and the psychological worlds. And I've been serving on the executive board now, as well as the faculty for the International Pelvic Pain Society. And I teach and I work and do consulting internationally, and it's just something I'm really passionate about. So I love that I'm here. And while I'm going to go through this very quickly, know that I am, I encourage you to reach out to me if there's any questions that you have after this presentation. So we're going to look at defining psychoneuroimmunology and kind of why that's important when talking about mindfulness and the power of the imagination, and why that's useful when we're looking at healing the body as well as the mind and the heart and the spirit. And we're going to go through a few simple and easy techniques in order to shift the brain and the body's reaction. And based on time, it's important for me to leave. I know Dari has some really great questions for me, and you guys may have some questions for me, and I want to leave time for questions. So I'm going to be talking about the techniques and really the order of events in terms of the order of the techniques to do before even getting to mindfulness, and we're going to talk about why that is. So, which might actually answer some of the questions that were sent to me ahead of time. So the field of psychoneuroimmunology is a newer field of research. It's not a new concept by any means within the greater scheme of the world. Certainly Ayurvedic medicine and Chinese medicine and a lot of indigenous medical practices have talked about this concept of it's all connected for millennia. But now we're really getting the research and the science to back it up, which is really exciting. So psychoneuroimmunology is the concept that it's all connected. It's the concept that stress and strong emotions and beliefs create biochemical changes that affect the nervous system and the immune system and the cardiovascular system and every system, every organ system, every functional system in the body. And how that creates a dis-ease, an imbalance in the system. But conversely, relieving that stress and calming down that nervous system and helping balance the brain and heal the hardware of the brain in order to be able for the nervous system to get to that place of calm, that creates and restores homeostasis in the nervous system, which restores homeostasis in the immune system, and everything can heal downstream from that. So I use the metaphor that if, when, say, there's a lot of factories up in Michigan that put a lot of pollution in the Mississippi River, which creates what's called the dead zone, which has continued to expand right where the Mississippi River goes into the Gulf of Mexico, where there is not enough oxygen for anything to survive. And so people have tried many years to just try to clean the water in that area, when what the problem is upstream, right? We need to stop the amount of toxins and pollution that's put in the river to begin with, that goes downstream, that creates that problem. And so this is that same concept. But when we're looking at pelvic and sexual pain, we're going to be looking at healing both sides. So it's not just healing the brain and waiting for everything to trickle down. We want to do it at the same time. There's a lot of physical things and ways to support the system in terms of from the bottom up as well as the top down, as we say. And I don't have time to go into all of that, but we're going to be talking about the top down today. But know that it is absolutely all connected, and all pieces of the puzzle as far as mind, body, heart, spirit, everything is really important to tune into, particularly once we get to that place of chronic imbalance or a habit of imbalance. So the good news is pelvic and sexual pain, which again absolutely includes pudendal neuralgia, is all healing. It is the same. So it's all part of the same nervous system. It's guided by the same brain. It does create the same stress response, and therefore the same immune response as chronic pain anywhere else in the body. It changes the brain in the same way as stress and trauma and pain anywhere else, or in any other way. But it also it heals the same, and it needs the same things to heal. What can make it feel more difficult, and in reality, therefore it makes it more difficult, is all these different pieces that are listed here, right? It's the area, the location of the body seems to scare away most healthcare providers, let alone it can scare us away from talking about it, because it's in a private area. It's an area of the body that we learn to keep private, where we learn to be ashamed of even talking about it, right? We don't talk about our toileting habits, let alone if we have pain down there. The closest we get is to be able to talk about low back pain and hip pain, which is in the pelvic region, but we tend to not feel comfortable talking about that area. And if we are comfortable, usually the people we're talking to, they're not comfortable. And it still boggles my mind how we can go to a pain specialist and they will talk about pain anywhere else in the body, unless it's in the pelvis, let alone the genitals. So that creates a whole different complex problem and a huge stressor, right? Because when we can't talk about it, and when we feel like we don't have someone to talk to about it, that increases fear, that increases mystery, that increases that sense of shame and secrecy, and we're holding more stress in, which is what creates imbalance to begin with. So there's that piece of it. Then we also certainly know that it's a part of the body that we can't fully rest, right? If I break my leg, I can cast it and I can rest it. And I might understand that maybe an ACL tear takes 9 months to heal, but it rests and I don't have to use it. And that's how it's able to heal in 8 to 9 months. But again, when we have chronic inflammation or hypotension in the muscles and within the pelvic floor, let alone all the organ systems that can lead to the kind of, again, the domino effect of neuromuscular issues, including pudendal neuralgia, that's not a part of the body that we can rest because we still have to toilet every day. We still have to sit and stand and move and walk. And so it just affects every aspect of our life. So it just makes things more complicated. And certainly my field in terms of therapists and sex therapists, they're no better, so to speak, right? So counselors and therapists, they don't talk about sex. They tend not to talk about sex or anything sexual, and they're not trained on how to do that. It's not in the graduate school. And sex therapists aren't trained in pain. I had one class on sexual dysfunction, and we maybe touched a little bit on pain, but we're not even trained on how the brain changes with chronic pain, with trauma. So there's so much of what I teach and what I know and what I've utilized throughout my career that I did not learn in grad school. It was very much self-taught. You have to seek it out. And it's the same for physicians and healthcare providers. So it's, on one hand, it's not their fault because they don't learn it. They don't teach it. And my colleagues and I at the International Pelvic Pain Society are working very hard to create the curriculum and to get that into the medical schools. And I'm trying to get it into the graduate schools. But all of that, of course, takes time and has its own politics about it. But we're working on it. So know that there are movers and shakers all over the world that are working hard to make that change happen. But that's certainly what makes it different than pain anywhere else in the body. So when we're looking at healing and when we're looking at the goal being practicing mindfulness for a variety of reasons, but ultimately wanting to be able to visualize healing, visualizing the life that you want, visualizing how you want your body to feel and move and function, we're thinking about sports psychology, right? So visualization is 70% of an athlete's success. And there's science behind that. So, it's 30% talent and practice and 70% visualization. Are they able to feel like a winner? Are they able to visualize that ball going into the net or whatever sport you're thinking of, right? They have to feel it. And any time during the Olympics, you'll hear an Olympic coach on NPR or during an interview say, if my athlete can't visualize and feel that gold medal around their neck, I won't even train them because they understand how important visualization is. So visualization creates the blueprint in the mind for what we want the body to build. So the mind is the architect and the body is the builder. The problem is that when we're in as much pain as we are, when we're dealing with intense chronic pain and neuropathies, particularly in an area that is such a private, vulnerable, sensitive area, physically and emotionally, it changes our brain, first of all, and it makes it almost impossible to actually visualize. It makes it really difficult to be in the moment and to meditate and to take that level of focus that visualization requires. And it gets in our way. And so what ends up happening is we get stuck in that fight or flight mode because of how pain and trauma and stress and the stress of everything changes the brain. Fight or flight mode becomes our new default. And then that new default mode only gives us the nightmare vision, right? So then we're only able to visualize or imagine the life that we don't want, right? Because fear becomes the soundtrack. And so what we know is, and what we're learning a lot now also through AI and virtual reality, again, us hypnotists have and sports psychologists have known this for quite some time, the power of visualization. But now through virtual reality research, we are seeing and getting so much more science behind the power of imagination and how if we can imagine seeing something, our body reacts, our body reacts. Our body does what we are imagining it doing, right? If you ever kind of had a nightmare of falling, my son actually woke me up the other night because he was laughing at himself. He said he had a dream that he fell and tripped, and his body jolted, which then the jolting woke him up, right? So again, what's happening in the brain is resembles a weaker form of actually doing or sensing, and our body reacts to that. And so if we're stuck in fight or flight mode and we're only imagining what we don't want, we're giving the body the blueprint of what we don't want, and then it can get stuck in that habit. And again, this is a completely unconscious process. This is not something that you're actively choosing to do. This is just something that the brain does. So the goal is to get to a place where we can practice mindfulness, which is basically the practice of paying attention in the present moment with compassionate curiosity. And compassion is a softness. Curiosity can cure anxiety to a degree, right? We want to be curious about it. All of a sudden that engages the higher cortex and pulls us a little bit out of fight or flight mode. But again, if we're at a level 20 from 1 to 10, a 1 to 10 pain scale, being curious is really hard to access physiologically for the brain. So again, we need a way to calm the system in order to be able to do this. We have to help the brain out, because the brain as an organ needs support to do what we're asking it to do. Mirror neurons are neurons in our brain that mimic what we observe with our senses. So that's why when someone has a big surprise look on their face, you can see someone, that's watching them, their eyebrows go up, right? It's a mirroring effect, because again, what we see, we react to. Or if someone starts laughing, you might start laughing. Or if someone yawns, you're yawning, right? So, mirror neurons literally mirror and mimic what you're observing. And that does happen with folks, even if they're visually blind or congenitally blind, right? So even if they've never seen, so it's more than just visual sense. It can be sounds, it can be sense, it can be smell, it can be energy, but I don't have time to go into the quantum mechanics of that. Then again, visualization is the actual practice of using your mind to imagine something. But this requires your brain's hardware to be restored to a certain point, at least, to be able to do what we're asking it to do. Because with chronic pain, with persistent stress, with trauma, so it could be kind of trauma with a little t, right? As far as things that happen over a prolonged period of time, maybe bullying at school, or 10 straight days of rain and gloominess, or working under a stressful boss, or final exams, or whatever it might be. Persistent stress, and anyone, which is everyone, lived through COVID, right? And that was months of stress. That changes the brain's hardware within 10 days. It only takes 10 days to change this hardware. And so what we see with these hardware changes is decreased communication between the left and right hemispheres, decreased cerebral cortex mass. So we actually lose mass, just like people lose muscle when they are stuck in a hospital bed for more than a couple days. We lose mass of the brain, almost of the cerebral cortex, almost sometimes up to 50%, which is a lot less highways between the hemispheres. And the anterior cingulate cortex is a part of the brain that's what I call kind of the main bridge, like the Golden Gate Bridge between the two hemispheres. That starts to malfunction, and I say the bridge is out in some cases. And so there's just a major backup of information, which creates more of almost like a bottleneck. So things, a smaller and smaller stimulus will set off a larger and larger response. And that's when we start to have that catastrophizing experience, right? That symptom, it's a symptom of the brain, right? Where we start to have that hyperfocus or the repetitive thoughts, or we feel like we can't relax. That's a reality, because the brain literally gets stuck in fight or flight mode, and it becomes harder and harder for the brain to process information, which is why the nervous system feels like it can't relax. And then we have what's called the bathtub metaphor, which is things that can build up over time. So where we're looking at ACEs as far as adverse childhood experiences, we now know generational and ancestral trauma plays a role in this. But think of, we're all born with something called a brain's reserve. We're born with a certain level of water in our tank. And the more the things happen to us, whether again, it's little grains of sand of just irritants throughout our life, or big things like a car accident or surgery, all of these things raise the water level. And then it might be that one final thing that drops in that bathtub that overflows the water. And now we have what's called central sensitization or chronic pain, or now we have, the imbalance hit too much too far. And now we have an overactive immune system where the body keeps creating scar tissue or keeps creating inflammation in all different types of ways that it can, and how that plays out. And then on top of that, we have what is called the faucet of fear. So imagine that this not only is life events filling up your bathtub, but when we're in that fight or flight mode, the faucet is on. The faucet of fear is on. So that's filling up the water even faster. And if we're not learning how to drain the bathtub through these techniques that are physically helping the brain process this information and release the information through all the different self-care activities, but again, some of these actual brain exercises that help heal the brain, then the water kind of stays overflowing. So we want to turn off the faucet of fear. We want to drain the bathtub on a regular basis. That's a lifetime practice. And we might need to address some of the stuff that's in the tub. So we might need to do some trauma work to help neutralize that. But again, what we can get stuck in are the side effects of those hardware changes in the brain. So I call it the software changes. So we need to update the hardware before we can update the software. And you might recognize yourself in some of these symptoms. And I'm going to go through these quickly because I want to get to the good stuff, the Q&A. So again, here are the symptoms. I'm not teaching you potentially anything that you don't already know in terms of these symptoms that you've experienced yourself, particularly if you have pudendal neuralgia. And again, you can provide the perfect interventions. You could be going to PT once or twice a week for years. You could be going to talk therapy once a week or twice a week for years, and you feel like you just can't get ahead. And it's because we haven't helped heal the brain. We haven't helped turn off that faucet of fear. So that's what these techniques do. So see this as kind of an order, right? Kind of top to bottom. Notice how mindfulness is at the bottom, because we have to be able to balance and heal the brain in order for the brain to be able to do the mindfulness-based exercises. Now, mindfulness-based cognitive therapy is about joining the efforts and the brain exercises of both mindfulness-based stress reduction techniques, as well as the cognitive behavioral therapy techniques of being, we need to have the brain hardware healed enough to be able to be in the moment. And we need to be able to be in the moment to know, what is it that we're thinking? What is it that I'm believing? So then I could do something about it, right? I need to be able to be present in order to notice what radio station I'm listening to, realize I don't like that radio station, and then I need to change the station. But if you've ever kind of been driving and been out in la la land, right, and you're meditating, but you're meditating on something out here, you're not even realizing what's on the radio. And until either you miss the exit, right, or maybe you kind of snap out of it and you're just like, hold on, what am I listening to? Right? And then you change the channel. So it's hopefully that metaphor makes sense. So I'm sure all of you, we've talked a lot about mindfulness culturally in the past 10 years. So I'm not going to go into all the things that can entail, because there's a lot of different exercises that can entail. What I want to highlight is this order of events that needs to happen in order for your brain to be able to do that. Otherwise, practicing mindfulness is going to increase that faucet of fear. It's going to increase your stress, because it can be stressful to try to relax when the system's not able to relax. Trying to focus on something when you have brain fog and you're in a level 20 pain is stressful. And then you feel like a failure, right? Then all that medical gaslighting and that victimization, that victim blaming stuff, that's the narrative that starts to play, right? It's my fault that I can't practice this visualization, that I need to be able to heal. And again, it's not your fault. It's just that we have to help heal the brain first. So I encourage you to start with bilateral stimulation music. Dr. Jeffrey Thompson is the head of the Neuroacoustic Research Center through Stanford University for 35 years now. I've been listening to his music ever since college. He at scientificsounds.com, he has a specific pain bundle. So it's a 7-track series. You listen to track 1 for week 1, track 2 for week 2, and it's backed by neuroscience and brain scans. It stimulates and heals the brain through those 7 weeks, through that 7-track period. A lot of his old stuff is available on Spotify and Apple Music for certainly a lot cheaper, and that can work also. But I've had great results with his pain album, his pain bundle. Then once that feels comfortable and safe, then we can go to more of the breath work. And there's circular breathing, there's triangle breathing, and there's box breathing. So circular breathing is about breathing in and breathing out for equal counts. The HeartMath Institute teaches circular breathing, has tons of great research on how that balances heart rate variability, and how once we train the system to have strong heart rate variability, again, the whole system comes back into homeostasis, and we're seeing amazing results with healing and diseases going into remission that we never thought were possible. Triangle breathing is breathe in, breathe out, hold, and all for equal counts. And box breathing is same concept: breathe in, hold, breathe out, hold. So again, nasal breath work is, and I say nasal breath work because breathing in the nose, there's more oxygen receptors, and you can increase oxygen in the brain faster by breathing through the nose. But again, breath work requires being able to be in the moment. It can be triggering sometimes when the system is really still hypersensitive, because when you have pudendal neuralgia, you have a tight pelvic floor. If you've had a tight pelvic floor, you have a tight diaphragm. When you have a tight diaphragm, breath work can be hard and challenging. And so again, you might want to start at a 4 count and not try to do the diaphragmatic breathing, not try to breathe for 6 counts in and 6 counts out, because your diaphragm might not be able to do that. And so again, start where you are, and then and gently move through this. I am a huge fan of meridian tapping, the emotional freedom techniques. The research is incredible. I learned this and started teaching this 20 years ago, and now I'm excited to have 10 years of really strong research internationally on it. Can't say enough about it. Yes, 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 yes. So emotional freedom techniques basically tunes in the bilateral stimulation efforts with tuning acupressure and acupuncture research, and it is the leading technique internationally for chronic pain and trauma. But it's free because you can do it on yourself. So my soapbox is that America usually doesn't like it because no one can make money off of it. But it's an amazing thing, and I would definitely recommend doing that. So once you start with those 3, then you can get into visualization and mindfulness and do those techniques. So this is more information on tapping and how you can approach this technique. This in and of itself is a mindfulness exercise, actually, because you have to tune into what am I thinking? What am I feeling? What am I sensing? But it's an active, what I call active mindfulness, because you can do something while you're paying attention, which is accessible to the brain while it's healing faster than more meditative mindfulness. So again, strongly encourage looking into emotional freedom techniques. And that is all. I hope, yes, I left a good 25 minutes for questions, and certainly tons more information on my website. So feel free to, and my book to reach out. So, Dari, shall we move into the questions?
Absolutely. Thank you so very much. That was so informative. And
yes, I know I went through a lot of information quickly, so people
you
can
did, but it was
listen to the recording, right? They can listen to the recording when you post it.
Absolutely. And now I would like to ask you some questions. You already addressed some of them in your presentation. Um, so I know this is the question that I hear the most often, or the comment is, mindfulness works for other people, but it doesn't work for me. And I think that you addressed that when you talked about healing the brain first.
Yes.
Uh, but if you wouldn't mind, stressing or giving us a little more information about how mindfulness or any of these techniques that you talked about, like the tapping or the breathing,
Yes.
would be helpful, regardless of your pain level.
Yes, absolutely. When you have chronic pain, asking the brain to tune in to the body, to tune into a place that has not felt safe for so long, is going to increase that faucet of fear that I talked about. And so it can feel counterproductive to a lot of people. And again, if we jump right into, let me try to pay attention and be mindful, people feel like they're failing, or they walk away with an inaccurate conclusion of mindfulness makes me worse. And that's an accurate conclusion in that moment, not an accurate conclusion long term. So we want to know that, again, it's making it worse because it's almost like too intense of exposure therapy. You're asking the brain to pay attention to the main thing that's been a source of trauma and a source of stress. So helping the body feel comforted through the bilateral stimulation of either the music first, and you have to listen to it with headphones because it has to stimulate the left and right hemispheres of the brain differently. Or again, the tapping, and you don't actually have to tap if that is agitating. So I work a lot, with some neurodivergent folks, or again, folks that have dysautonomia or really just full body systemic sensitivity. And so tapping sometimes can be agitating. So know that just rubbing the area can provide that same relief. And so that is a way to help soothe the body first. And once the body starts to feel safer physically and emotionally, then it becomes literally safer to pay attention, to tune in. And I like to start with what we call active mindfulness, which is doing something while paying attention. And that could be brush your teeth with your non-dominant hand, because then that makes you pay attention to what you're actually doing. Or when you're washing the dishes or cooking, can you pay attention to the colors and the smells and all those different things? Go for a walk, pay attention to things outside of your body. Here in the Northeast, right, it's a beautiful time of year to walk around and look at all the different colored leaves, right? So paying attention to things outside of ourselves is safer than paying attention internally. And so we do a quick I Spy, is one of the recordings on my website that says, okay, what do you see, hear, feel, taste, smell outside of you? And then when that practice feels safe, then move internally. And then we can start to tune in that way. And then again, use the mind to start to visualize.
Thank you. That's very, very helpful. Now, you already spoke and you addressed the difference between mindfulness-based cognitive therapy and mindfulness-based stress reduction. So I guess we can skip that question. Now, one of the things that you addressed initially was the lack of education in medical school regarding this issue of sexual and pelvic pain. Is there anything that we can do at our end as patients to kind of normalize this conversation?
Oh, I love that question. That's a great question. Yes. So I think advocating for every healthcare provider that you see, whether it's a physician, a PT, a nurse practitioner, a physician assistant, a health coach, or even a counselor, first ask them if they've ever gone to a conference where they've talked about these issues.
Mhm.
And I mean, that's just important to know, because if they haven't, then how are, they should. But if they have, how can they encourage their provider to advocate at these places, right? Because again, things happen from the grassroots level when we're looking at changing the board exams, which, because if it's not on the board exams, they're not going to put it in the curriculum and people aren't going to study it. So it's advocating on the level of your provider and your community. Maybe it's seeing if you can bring in a speaker locally to teach and kind of bring a group of like-minded professionals together to learn. Locally, I like to have kind of my pelvic pain crew come together once a year and have dinner, but also have a presentation on some of the latest research that they've learned through their specific specialty. Because again, it's very much self-taught. It's very much self-advocating. So that there's that piece. They can also write their local congressmen and kind of legislature folks to lobby and to advocate for funding for research in these fields, because when there's funding for research, that allows there to be more research. When there's more research, then we can get it into the curriculum. But the funding around these issues has been lack.
Yes, absolutely. Absolutely. Now, I wanted to ask you also, one of the questions that I shared with you initially is, a lot of people say, I cannot sit still for 10 minutes. How could mindfulness or meditation or tapping or any of these techniques that you spoke about help these people maybe increase their attention span? Is that necessary or not? So could you address this question, please?
Yes. So when it's hard to sit still for a variety of different reasons, but definitely because of pain, I want you to don't try to sit still, right? Because that's going to be stressful. So that's besides the point. But will it become easier as you practice these types of techniques while moving and while doing things, such as, well, anything, whatever feels comfortable for you in the environment or doing the activity, even if it's a slow walk or floating in one of those salt tub pools, right? Doing what feels comfortable. Supporting yourself environmentally is step one to, again, establish a sense of safety. When the environment feels safe and when your body feels safe, your mind's going to be more interested and able to go there. Supporting the brain through bilateral stimulation while doing physical therapy exercises is usually the first thing I have people start doing, right? If they're already doing PT stretches and exercises, I want them having bilateral stimulation music in their headphones for 2 or 3 weeks. Then can they do the bilateral stim while doing their stretches and try to pay attention to their body while they're doing the stretches, because being present with the body with the stretches is really important. And then we can kind of start some of the dialogue work. But again, yes, through time, as the brain heals, it's going to absolutely be able to be able to pay attention. And it kind of a side effect of doing these stepping stones is going to be your ability to tune in and focus on more meditative practices, let alone just reading, as far as focusing on at work and being able to function that you might want to do. That will come, I promise. But the bilateral stim can be really helpful. People are able to put that music in and be able to function at work almost right away, because it just helps the brain connect immediately.
And I'm guessing that by increasing also that level of comfort also with your own body and being mindful of what you're doing, paying attention to other things, also by default it will start decreasing pain.
Yes. And what's important is, again, pain is a habit. It is a habit physiologically in terms of the signal being sent up the spine, which I don't have time to go into the physiology of right now, but it is also a habit of the brain because it turns into an expectation. It's like every time I open this one cabinet where the dog treats are, my dogs come running in, right? So we wake up when we've had pain for a while, particularly a lot of pain, we wake up and we check in, right? It's a habit of the brain to check in because that's what the brain does. It's a risk management it's amazing at risk management and so it's one of those things where sometimes a common thing I say in tapping sequence is thank you body for trying to keep me safe by checking in incessantly with how is it still there? Is it still there? Is my pain there? Is it still there now? Is it there now? Right? It's like that child in the back seat. Are we there yet? Are we there yet? Are we there?
Yeah.
Thank you, brain, for trying to keep me safe. I'll take it from here. So
Yeah.
that's something I commonly put in my tapping sequences. And at this point, I forgot your question, but
No,
did I
that's
answer it?
you're addressing. Yes, absolutely. Absolutely. And it's also, and of course, we don't want to give the impression that we create this pain just out of nothing, because of course,
No.
sometimes it's caused by, I don't know, a surgical procedure or fall or childbirth or there are many other reasons.
I'm
Um,
glad you brought that up because I want to emphasize again, there is no disconnect between the mind and the body. There's no disconnect between the mind and the body. The nervous system travels at 240 miles an hour, and the connective tissue, the fascia, travels even faster than that.
mm,
So by the time you're aware of it, it doesn't matter where it started because
mm,
both are happening, right? Both the nerves are firing, the muscles are reacting, there's inflammation happening, which is aggravating the nerves, which is aggravating, right? The process, the factory has already started the conveyor belt of the process, and the brain is responding to it. When we look at the bathtub metaphor, what we know is that the more we empty that bathtub, not only are we able to turn the volume down where that factory might start, but we can keep it at a lower level. It's
mhm,
going to be easier to take it from, say, a 5 to a 1
mm,
rather than trying to get from a 10 to a 1. But I will also say that we need to heal the brain and get the system used to release get in a calmer state. And brainwave wise, it's getting out of beta brainwaves and more training the brain to stay in alpha brainwaves, if not delta. And then the brain has to be here for a while before the perception of pain actually changes.
mm,
Sometimes it can happen right away, but there can be a delay because again, I might relax and my system might relax, but if this is the first time I'm relaxing, my
mhm,
brain's going to be like, something's wrong, I'm relaxing.
yeah. Yeah.
Right?
Mhm,
So, again, some might say, well, I feel more relaxed, but my pain is still there. That's okay.
mm,
I mean, it's not okay. I wish I could wave that magic wand and your pain go away. But again, we have to give time for the body to heal. We can't, I'm not a car. I can't just replace the wires, right? And nerves heal at 1 millimeter a day. I will
mhm,
say lion's mane mushroom speeds up that healing exponentially. Um, but we have to allow the body, the process to heal, right? I don't believe my tomatoes won't grow just because I planted them yesterday and they haven't grown yet, right? I know that there's a process of growth. And so when we understand how the machine of the body works, we can trust the process. Believing in healing isn't a faith. It's just really understanding how the machine works.
mm,
So I never doubt that someone has the ability to heal. It's more, let's figure out all the different things that can get in the way of just slowing it down.
mhm. Yeah. No, and no, thank you for saying that, because it's a process.
Yes.
Um, and
Mhm.
it's not a magic bullet. Yeah.
Right.
And but Alex, if you wouldn't, I'm sorry, Dr. Milspaw, if you wouldn't
That's okay.
mind, if you wouldn't mind addressing these two questions very quickly, because I would like to get to the questions that people are asking on the chat.
Mhm.
Is you just addressed central sensitization, which is something that a lot of people with chronic pain are experiencing. It starts in one place, but it just becomes generalized. So you talked about draining the bathtub, turning off the faucet of fear. Do you have any other recommendations?
Yes.
Many, huh?
Oh, where do I begin?
Yeah.
The, I will say, tuning the brain gut axis is where is central station. In order to heal the brain, we have to heal the gut.
Mm.
And in order to heal the gut, we have to heal the brain. So there's a great article that came out last summer, 2023, Microbiota is the first word of it. And I can send it to you, Dari. Maybe you can post it. But it's a huge meta-analysis and study that finally came out of that demonstrates how chronic inflammation and an imbalance of the microbiome, or the good bacteria and bad bacteria in the GI system, absolutely dictates the sensitivity of the central nervous system and the peripheral nerves. And let alone systemic inflammation, as far as the mucosal layers. So within 1 hour of the gut being inflamed, there's inflammation in the brain. And as soon as you feel inflammation in the brain, you're going to have symptoms of anxiety, of depression, of OCD, of sleep disorders, of mood and crankiness. I mean, things just go haywire. And it could be as simple as, I shouldn't have eaten that sushi from Weiss, but we can't heal the hardware of the brain when there's inflammation here. And in order to get the inflammation out of the brain, we've got to get inflammation out of the gut. So healing both is absolutely a necessary part of what I teach and what I work with. But we also can't heal inflammation in the gut without calming down and balancing the brain activity, because stress and angst and worry and that faucet of fear is going to create GI agitation and inflammation.
I really appreciate that. Yeah. And also, just to hang on to what you just said, you have a wonderful diagram on your website also on how all these systems are joined together, and you cannot really address one without addressing the other. So I think
Yes.
it would be wonderful if you can share that with us, and if you can share the slide on how to turn off the faucet.
Yes.
Or any other information that you have presented that you would like us to post on our website, we will be glad to do that.
Okay. Yes, I'm making a note of that.
So thank you. Oh, I will remind you. No worries. Okay, let's take some of the questions. Someone is thanking. I'm so sorry. Here you go. Okay, so one of the questions: are your techniques related in any way to pain reprocessing therapy?
Yes.
Okay.
Yes. What's funny is I had an amazing mentor. I have an amazing mentor, Dr. Charlie Curtis. And again, he taught me all of this 20 years ago. And about 10 years ago, people started catching on, and now they have all these fancy new names. that, yeah. So yes, that is a name for everything I'm talking about.
Yeah.
People like to take credit for things that have been around for a while, and then they put their own name to it, which is funny.
Absolutely. That always happens. Yeah.
Short answer is yes. That's
Yes. Okay. Sounds good. Okay, let me take this one also. I say, if the pain is definitely from a trapped nerve, I don't understand how all this can work.
Yes. So know that the nerve was not always trapped, for one. And the body always knows its way out of a situation. Whether it's ability to release and manipulate and kind of make space around the nerve manually, through pelvic floor PT and myofascial release to create space in that area, release the pressure from the piriformis and the internal obturator that puts pressure right where the Alcock's canal is and where that pudendal nerve comes out. It's a congested area, and it's easy for it to get more congested, particularly with scar tissue and inflammation, and the inflammation and how that makes connective tissue very sticky and rigid. So the body is always capable of change. And let's say, for argument's sake, that we can't change any of that.
Mm-hmm.
What we can change is how the brain reacts to that signal that comes up. Because the signal that comes up For example, in phantom limb pain, even though there's no foot, there's still a signal that's literally getting sent up the spine because they can measure it with their, these devices now, right? We can see that there is the electrical signal being sent up the spine, out of habit, because the brain, that what happens is the dorsal root ganglion and the spine goes away, and then the spine starts sending the signal up without asking the body if it's actually still important. So again, it's like an electrical malfunction that happens in the spine, but we can still retrain the brain to say, notification off.
Mm.
Just like on your phone, we
Yeah.
can train the brain to turn the notification off that says this signal is no longer important. But in my experience of working with folks with pudendal neuralgia, it's usually a mixture of both that we need to do. We want to turn down that notification, and we know that we can create space in the Alcock's canal.
Yeah. I appreciate your answer and the question also.
Yes.
And I can attest to that. From my personal experience, I do have pudendal nerve entrapment, and and I was in a great deal of pain when we first met.
Yes.
Uh, and that's really, I mean, of course, I still have it, but it's not excruciating because I did, you do the mind-body connection also with working with the medical profession, which,
Mm-hmm.
sometimes you cannot leave that out.
That's right. That's
So
right.
thank you. Yeah. So for personal experience, I can also answer that question. Yes, it is possible. Um, okay. Another question. Can we watch and listen to this somewhere? Yes, we're recording it and we will post it on our website. Uh, Another question. With tapping, if you listen to bilateral stimulation music instead of speaking thoughts, would this have the same effect?
Yes. Yes. So what I love about the music is you don't have to pay attention. So it is the most passive thing that someone can do and still really affect their brain in a positive way. Because I work, first of all, there's an interesting study that came out of France a couple of years ago that said the majority of people with chronic pain issues are type A and have neurotic personalities, which means we're really busy, awesome people, and we love being productive. And I will be the first one to raise my hand and say, yes, that's me. Um, but
Yeah.
what that means is, it's hard for me, when I'm working with someone that works a high-end job or very busy, or again, just can't pay attention or don't want to pay attention to what's happening yet within the narrative of their mind. You can put the music in and not pay attention to what you put it in, and then do whatever you need to do. Listen to it on your commute, listen to it while you're working, listen to it while you're doing chores around the house, whatever it might be. You don't have to pay attention while you're doing it. But is there benefit to allowing yourself to rest and relax and listen to peaceful music? Yeah, absolutely. There's that too. But no, you don't have to pay attention or do anything while listening to the music, which is why it's an ideal first step.
Yeah, so that would be ideal for beginners then, because
Yes.
that's one of the questions that we talked about, is that some people feel that it is very overwhelming to start something new when they are in an incredible amount of pain.
Yes.
So my question to you was, what do you recommend for beginners? And sounds like music.
I would say
It's
absolutely. Yeah, the bilateral stimulation music and, tapping. There is a tapping app called the Tapping Solution. Brad Yates is someone I follow on YouTube, and I don't get money for saying any of this.
Mhm.
But, as someone for myself who has had multiple brain surgeries and traumatic brain injuries, there's where it hurts to think. It hurts to pay attention when there's that much inflammation and swelling in the brain. The bilateral stimulation was a godsend to me. I mean, it was the kind of the basic, but so effective and so helpful. And my niece, who struggles with epilepsy and chronic seizures, it's that same thing, right? It hurts to think and try to do something. And the bilateral stimulation has been a game changer for her, in her ability for the brain to heal faster from seizures and faster from concussions and things like that.
Yeah. No, thank you. It is. I swear by it too. And tapping. And also the tapping solution app is free. There's certain exercises that you have to pay for additional monthly fee, but in general, it's free. And there are many, many videos online for it.
Yes. Yes.
Another question just came up. Um, it says, where can we get music for free?
Spotify. Do you have to pay for Spotify? I don't know.
I know Pandora, you don't have to pay for Pandora unless you want it to be advertisement free.
Right. So if it's from someone else other than Jeffrey Thompson, or HemiSync, that's an organization that's kind of risen up in the past 5 years. HEMI, standing for hemisphere, sync, SYNC, like synchronization. So hemisync.com, they have both free and to pay for music. But between HemiSync and Dr. Jeffrey Thompson, I can't say that any other music is does what it says it does as far as bilateral stimulation. But also with things like YouTube, I can't promise that the way it's uploaded is that it's uploaded correctly. Because again, it's what's really important is that what's in the left speaker is different than what's in the right speaker. Right. So there's the production of the music is key in the science of it.
No, thank you for that clarification. Now, let me see if there are any pressing questions. Definitely, I think we answered most of them. Any last thoughts?
You can do it. I believe in everybody. And I am a cheesy person, but I'm not just saying that. I really do believe in this work. I practice what I preach. I share some of my own personal story in my book. And it's, I don't teach anything that is not absolutely backed by science, that has been repeated in more than 2 countries, I will say, because multicultural, it being repeated throughout a variety of different populations is very important to me. But also, but certainly I don't teach anything if it also wasn't helpful for me. So know that everything that I talk about and I've talked about tonight is absolutely backed by a breadth of research, and let alone my 18 years of professional experience. I've seen miracles happen, and miracles simply mean that we don't understand how it works sometimes, even though now we do. But it's possible because that's just what the body does. All the body does is knows how to heal. We just have to help get stuff out of the way.
Absolutely. And I can attest to that because I don't know if you remember when we first met many years ago. Yeah. I was staying with my son in New York. And of course, I had to take the train back after our meetings. And I was developing a debilitating migraine.
Yes.
And you did an exercise with me that had absolutely nothing to do with the migraine. You gave me a grape and how to be mindful about the taste and the shape. And the migraine disappeared automatically. And I have never experienced that before. So I can attest to the fact that this definitely does work.
Yes, absolutely.
Yeah. Well, thank you. I really do appreciate it. And
yes, thank you so much.
No, thank you for your time and this wonderful presentation. And just to let everybody know that we have recorded this presentation. It will be posted on our website as soon as it's ready. The recording is ready. And also, I think, Alex, you promised to share some PDF information with us, and we can also post that on our website. Okay?
Yes, I will share the slides. I'll share more information about that microbiota article, and I'll send you the link to a hidden page on my website that has a lot of recorded exercises that people can follow along with.
That's wonderful. And what is your website? Where can people get in touch with you?
Yes, absolutely. Yep. There's a contact form there.
Okay. Thank you so very much. Have a wonderful day, and thanks for everyone who joined and asked questions.
Yes, thank you, everyone.
Wonderful rest of the day. Bye.